So after ruling out all secondary causes, you can say that the patient has essential hypertension, which means it's primary, and which means it's idiopathic, and is also the case in 90 to 95% of all situations. So this is when the patient has isolated hypertension and there is no other cause that can be identified. This is, of course, the most common cause, like I mentioned, and what you're going to do is since this is the most common and सिर्फ 5% of बाकी cases हैं तो it makes sense कि आप patient को antihypertensive medication start करा दें. And if it doesn't respond, then you explore secondary causes. So you start with giving an antihypertensive because you're assuming or you're working with this assumption that it is primary hypertension to begin with. And then if it isn't resolved with antihypertension, that means that there is another underlying issue. And then you go to solve the underlying issue, which is the secondary causes, right? Um, so, how would we classify different types of hypertension? So, एक तो normal है जो कि हमें पता है 120/80 है, ठीक है? Then elevated is slightly raised, right? तो slightly raised में हमारे पास 130 systolic है, लेकिन हमारे पास less than 80 is still considered in the elevated range. लेकिन इसमें 130 हो जाता है. Stage 1 hypertension is when we're looking at numbers like 140/90, and then stage 2 hypertension is when it exceeds that. So it exceeds 140/90. And then जब हमारे पास crisis होता है ना, what is a crisis? Crisis is when it's more than 180 and it's the diastolic pressure is more than 120. So just bear that in mind. फिर उसके बाद मैंने कहा था कि I'll tell you what BMP is, the baseline metabolic sort of profile, जिसमें हम BP monitoring करेंगे, bloods करेंगे, urine, ECG, echo, and fundoscopy. So these 6 things: BP, bloods, urine, ECG, echo, endoscopy. और bloods में फिर of course CBC देख लेंगे, electrolytes देख लेंगे, creatinine देख लेंगे, fasting glucose, and lipids, right? So the first thing we're going to do is advise lifestyle management. Lifestyle management, of course, is first and foremost. उसमें हम weight loss कह देंगे, हम DASH diet कह लेंगे, which is diet against something hypertension. Salt restriction करेंगे less than, हम कहेंगे 2.4 से आपने कम ही लेना है. Then we're going to ask the patient to exercise, no alcohol or smoking, and stress management, because these are all, if you remember, risk factors. Now, what are the pharmacological management? तो इसको याद करने का तरीका है कि कुछ first line है, कुछ others हैं, कुछ pregnancy, कुछ elderly. ठीक है? So first line, the first letter of the alphabet is A, right? So think about ACE and ARBs. Now, ACE and ARBs कौन सी चीज़ों में ज़्यादा यूज़ होते हैं? जो disease process है. तो डिजीज प्रोसेस में हमारे पास CKD आ जाता है. तो जब भी CKD का केस और हाइपरटेंशन हो तो वी थिंक एस एंड आर्ब्स. लेकिन इट कैन ऑल्सो बी इन अ पेशेंट विद कोएग्जिस्टिंग डायबिटीज या पोस्ट MI. ठीक है. कैल्शियम चैनल जो ब्लॉकर्स है ना, वी थिंक अबाउट दोज व्हेन इट कम्स टू एल्डरली. एंड इफ फॉर एग्जांपल वॉल्यूम ओवरलोड है, ठीक है, एंड वी नीड टू गेट रिड ऑफ दैट, तो देन वी कैन यूज thiazides. नाउ बीटा ब्लॉकर्स हमें पता है कि हार्ट की अपनी एक्टिविटी को कम कर लेते हैं. तो अगर हमारे पास मायोकार्डियल इन्फार्क्शन है या arrhythmias हैं, that's when we can think about beta blockers. And then remember, aldosterone antagonists like spironolactone हम यूज़ करते हैं जब हमारे पास resistant hypertension है. और हमने resistant किस में कहा था? Secondary के हमने किसी cause में कहा था above, which was coarctation of coarctation it was renal artery stenosis. This is resistant to antihypertensive medication. Renal artery stenosis. Acha, back to where we were. So pregnancy में हमारे पास पता है, we know कि LBM है, sorry, LMN है, LMN. So you use labetalol, methyl-dopa, nifedipine, but remember कि ये एक CNS depressant है, ठीक है. फिर उसके बाद elderly में हम लोगों का ये होता है कि we don't want to lower their blood pressure एकदम से, because that could lead to orthostatic hypotension. Remember that this yellow color shows complications, so we have to do it little by little, slowly. So to remember the medications, इसका एक mnemonic है ABCD, ARBs, ACE, beta blockers, calcium channel blockers, जो कि remember we use in elderly, and then diuretics like thiazides. And then causes of secondary hypertension में A for aldosteronism, so like cons. B for Bruy हमें पता है किस में होता है? Renal artery stenosis में. C for Cushing's and coarctation, and D for drugs, diet, and pheochromocytoma.